in a busy district general hospital, setting side room cubicle in the A&E department. You are talking to Sally Jones, the mother of Daniel, who is 13 months old. Background information: Daniel Jones has been admitted to the A&E department via his GP. He presented to the GP with symptoms of a mild upper respiratory tract infection, but on examination, the GP found him to be tachycardic with a heart rate of over 200 beats per minute. He called an ambulance to send Daniel and his mother to the A&E department. On arrival, Daniel was seen by the A&E registrar in the resuscitation room. His heart rate was 280 beats per minute. The cardiac monitor and ECG trace shows a narrow complex tachycardia, and he was treated according to advanced pediatric life support guidelines. After receiving one dose of adenosine, Daniel's heart rhythm converted to sinus rhythm. The pediatric registrar was called to the over Daniel's management. Daniel is hemodynamically stable and his ECG now shows evidence of WPW, Wolf Parkinson White syndrome. So the task to meet with Mrs. Jones to explain Daniel's diagnosis and your plans for his further management and to answer any questions that she may have.
Okay.
Okay, so I'll share the
Yeah.
white screen. Maybe you need to draw something.
No, I got the point.
Okay.
Yes.
So
So
you are
yeah,
talking to
please.
Sally Jones, mother of
Yeah.
13 months old Daniel. Start.
Then. Yeah. Bismillahirrahmanirrahim. Assalamu alaikum. Sorry. Good morning.
Good morning, doctor.
Yeah, I'm Dr. Irfan, one of the child doctor here, taking care of the Daniel. I'm talking to
Oh,
the uh, Daniel mother, Sally John.
yes, doctor. I'm St. Daniel's mother.
Yeah, nice to see you. And how was your trip today?
Doctor, I'm too much upset today. I'm worried. I don't know what is going on with Daniel.
I, yeah, I can understand your worries, and I'm here for this purpose to explain you all about the condition of Daniel. It's okay for you.
Yes, doctor. How is he now?
Yeah, he is doing well. His progress is
Okay.
monitoring, and he's doing well. He's stable at the moment,
But
and
doctor, no one told me what is going on because I
yes,
went to the health center and they gave me
exactly.
just he has some cold and these things. So they transferred him here. I don't know what is going on.
Yes, Doctor, Miss Silly. And how can I call you? Anything you want,
You may call me Mrs. Jones.
Mrs. Jones? That's great. Okay. So I'm here to explain you all about the Daniel condition, and I will answer all your concern. If you want anybody to join this discussion, you are most welcome.
No, doctor, it's okay. I'm alone right now.
Okay. So what has been told you up till now about the Daniel condition? Somebody has updated you about the condition.
Doctor, yes, I went to the some basic health center. They told me there is some problem in his racing of the heart. It is too much, or shouldn't be normally like this. But he's suffering from some cold, and this since 2 days. So I don't know, but he's fine. He's not that much sick or anything. So I'm worried there's something in the heart or what.
Yes, I appreciate you all your concern, and it's quite natural to feel like that. Did you heard about this condition? Like we are diagnosed. This is diagnosis with the Wolf Parkinson White syndrome. Do you have
What doctor? What you
any?
said?
That this is a condition which we call it Wolf Parkinson White syndrome.
So Dr. Daniel will have some heart problem. I don't know. It's some kind of syndrome. But he's fine totally. Nothing is there. He's totally fine. He was feeling well, and even his growth is okay. There is no any problem with him. And you are
I
saying now
totally
it's a syndrome, and
I
no one has did any test, doctor. How can you say like this for Daniel? Maybe you have some mistake.
Yes, so you are right. I can understand your all frustration at this moment. And if I explain you that what is this condition, usually this present since birth, okay,
Okay.
and some patient present with problem, and some may not present. Most of the patient remain without any sign and symptoms.
Okay, doctor.
Yeah, in this condition, what is the problem? The heart has an extra electrical pathway.
But doctor, you said he born with this condition, but since birth
Yes,
I had no any complaint. But now he's 13 months.
yes, that's what I'm asking. Many remain without any problem. Many
Okay.
people, we have seen lot of patients, they have no problem, and they are diagnosed
Okay.
accidentally sometimes when we do ECG. You know ECG, electrical cardiogram for the heart.
So
Have you
doctor,
any idea?
only this paper of ECG of this you are diagnosed. No other scan or any other CT or any other echo. I
Yeah.
heard about echocardiograph. So without any
Yes, you
test, how
are.
can you say it is this syndrome?
Your concern is very valid. I'm going to explain you. See, this is a sensitive thing for diagnosing this problem. Number one, okay, and some patient without problem. The what is the problem? Number one is the patient may have the racing of the heart all of a sudden, and they can have chest pain. They can have the problem of passing out. So these are the problem which comes with this condition. Okay, so we
But
have to
chest pain,
treat
doctor,
as
he cannot
yeah.
complain of chest pain. I don't know, it's very small. How can they? How do I understand it? He has chest
Well,
pain.
it's very really good concern from your side, and not all the patient present with all symptoms which I describe you. They may have chest pain. They may present with passing out. They can have problem in the difficulty in breathing.
So, doctor, what there
So
must be a treatment, right?
yeah, for sure, you are valid concern. We are here to help you for this thing. So there are
Thank you, doctor.
something which we can. Yeah, you are most welcome. We are giving the advice to patient. First of all, we like to involve the doctor of cardiology, the doctor of heart. Okay, he will
Hmm.
explain to you further. Before that, I will let you know how we can manage together. Me as a doctor and you as a parents, right?
Okay, doctor.
So, what are the things which will precipitate this thing? Any which will
Six minute,
trigger this? Yeah,
six
this
minute.
will trigger. Yes, thank you. This thing will be triggered by like if you are doing very strong exercise, strenuous exercise. Some people, if they drink alcohol, okay, we
But
need to
doctor,
tell
it's
them.
very Daniel is very small. How can I give him alcohol or he will do the extreme
Just
exercise?
giving you
I don't know.
example. I'm sorry to say, just giving you
Okay.
example. What things can precipitate this problem?
But doctor, what is actual problem inside the heart that is heart is racing?
Yeah, you are right. Yes, this is a very good question. This is a very, very good question. And then I will tell you what is the problem. Usually our heart contracts, meaning heart get tighten and squeeze,
Okay.
okay, to push the blood and then refill it by relaxing. There are electrical signal from the heart to control this pumping and relaxing for effective
Okay.
function of the heart. But some people with this condition, they have an extra electrical signal which trigger this problem, and they
So,
get
doctor, how
people.
do I know at home that he is suffering from heart racing? Is now he developed only some mild flu and these thing. I went to just I have no any concern about his heart racing. So, how do
Yeah,
I
you
know
are
when I
right.
go home?
You are very right. The patient will tell you, the person will tell, Danny will tell you, he has a bounding heartbeat.
But he's not
So he
speaking,
will tell.
doctor.
He said 13
Only
years.
13 months. 13 months, doctor.
I'm sorry, 13 months. Yeah. So you can appreciate this thing by any seeing the chest also. Okay. So if
Hmm.
you look
What
at
I will look
tummy,
for?
If you look for the, you can see the something, and he is very feeling of the something. I'm sorry to say this. You can see it as. I will tell you again for this in another way how to
Yes,
appreciate this
please.
thing. Yeah, but the thing is that when the patient is any person who has a high heart, he will not be comfortable. This is one
Okay.
thing. He won't be comfortable. But other thing to appreciate that he may have some difficulty in breathing in this age. Okay, so
Okay.
this is the thing which you have to do appreciate. And then secondly, any in the future point of view, we can say, and sorry for that. I'm sorry that for this thing we will refer to the doctor of heart. He will explain to you how to manage this problem. Okay. Number two,
I
it is
get
Okay.
quite
complete.
pure. Okay.
Thank you.
Okay.
Thank you,
Thank you.
Dr.
Acha,
Usman.
I was confused because I was thinking it's a 13 year. Okay.
Yes, to
Anyway,
all the scenario, you gave me about 13 years, so I will not
13
commit.
years.
It's okay because you all symptoms you told me about 13 years. In
I'm
between, I
sorry for that.
interrupted you, so he
Yeah, you're
cannot
right.
speak or he cannot tell me
Yeah,
like
yeah,
this.
yeah.
Two times I
Because
told you 13
I
months.
mean, this preoccupied with 13 years. So I was thinking,
Yes.
what is the, okay. Anyway, I'm sorry for that. Anyway, okay. Anyway, feedback not so good.
Okay, so yes, as you said, not so good because I was not expecting from you that
Yeah.
because uh, and initially even during introduction you were a little bit hazy. I don't know why. Usually very confident. You are more confident than the normal, but this time you are not that much confident.
Okay,
And
because I will tell you, because my children were playing, I was just
I
telling
was
them go for. Okay,
yes,
anyway. Okay,
I was
yeah,
thinking
right.
the same. I
Yeah,
was thinking the same thing because your concentration was somewhere else.
yeah,
So,
yeah.
anyways, it is happening
Distracted.
sometimes. So, but yeah. So here, because of this, maybe you forget the names and age and these issues.
Yeah.
Otherwise, the information you gave me in the chunks, it was good. When, but you did not ask me about my understanding about this thing. And the thing is about you should have to tell me what is WPW is an electrical activity, which you mentioned at the end after I asked you.
Actually, when you asked me that, when we started, that
Mm,
time I'm trying to, you asked your question, concern, because
mm.
then I was in between telling children go from here, and I was half of understanding what are your
Okay.
concern. Anyway, I'm sorry for that. Really, it was
Mm.
like that.
No, no,
Yes,
it's okay. It is happening nowadays. Virtual things. This is the routine. It's okay. So we hope in exam it will not happen, inshallah.
inshallah.
So the other thing, your knowledge regarding WPW was okay, but the something which I will mention that this
Hmm.
is my question was like my baby has nothing and he was very fine, only mild cold symptoms, and he was feeding well, everything was fine. Just I went. So at that time you can say yes,
Trigger.
mostly some of babies they are presenting like this because this flu is also kind of triggering this condition. So that's why when the babies are developing some kind of fever or some other thing, so they develop a racing of
Yeah,
the
these are the
heart.
triggers. Yes, because I thought
Hmm.
it is 13 year. Yeah, right.
Yeah.
Acceptable. Yeah, yeah. I totally accept.
Okay.
Yeah.
Another thing, when is there anything, something in the heart and these things? So at that time, you can say it can be scary for you because it is, if someone will say the problem in the heart, definitely it is scary for you. But don't worry, this is not thing which there is no treatment or that will cause we will go for any surgery or other thing. This is the thing, it will usually resolve by itself, but for the further I will also arrange a meeting with a heart doctor so that he can explain you more, so that you understand well.
Yeah. Right. Right. Right.
Okay. The
Yeah.
other thing, my question should be: is it a life threatening? Or I did not ask you because some other. So at that time, they are rarely they are having a life threatening condition, but which it's not the. There is some risk, but we have the treatment for this condition, and we will
Curable.
follow on.
It's a curable.
Yeah,
It's
Yeah,
a quite
we will
curable.
follow and close follow up. We will see. And symptoms, as you said, the mother asked you how may they present. At that time, you will feel that Daniel might looks sick. Maybe he has a vomiting. Maybe is a difficulty of breathing, as you told. Maybe he has excessive sweating, and sometimes he might have a you feel that drowsy and refusal of feel. So
Right,
if you feel any of one, you should contact your nearest hospital as soon as possible.
right, very right. Because I
The
was totally distracted today. I'm sorry for that, really.
yeah, it's okay, no problem. So anyone else has the comment? Comment? Anyone else wants
You
to
have
add
given
something?
almost.
Mhm. Okay. In this, they are saying senior picture is very important. You should make draw a picture of electrical activity so that they understand that
Yes, right.
diagram.
Yes.
I think Dr. Bhatti was not in a good mood today.
No, no, not
No,
good.
no, he
Distracted
explained
me.
that he was distracted a little bit.
Total
It's okay.
distracted. Many
Yeah.
Yeah.
starting was little bit introduction. Also, you did not address the context. Like before was, it was kind of emergency condition. Now settled down. Drawing was missed, and
Yes.
the information regarding this scenario about the possible treatment, how to deal when the situation happens, how to recognize, uh, like now there is a racing of heart in such a small child. He asked you, role player Dr. Vakar, he asked you how to appreciate this thing, and possible outcome of this condition, like after surgery, very good prognosis, ablation surgery. If it is
Yeah,
not
very good
responding to
prognosis.
the treatment, first you start the, when the symptoms happen, the basic care, like application of the cold water or Valsalva manure. Child is a small, so it's not easy for child to do Valsalva manure. But
Right.
application of the cold water you can advise, and it can be risky, life-threatening. Yes, it is life-threatening. Sometimes it can cause death if it is not treated in the right time, in the right setting. And
Dr. Hiren, we will not.
hmm, and medical management, the medicine, flecainamide and all, there is a like oral medicine. Cardiologist will advise about the medicine. And then the permanent cure is surgery, ablation,
Radio ablation.
radio ablation.
Yeah,
Yeah,
this
right.
we will not advise mother about surgery. Uh,
No,
if
if
mother is
asked,
asking,
yeah,
because
if,
it is first presentation, if you will tell the surgery and heart surgery, it must be a lot of scary. But we have to inform in the way so that she did understand very well. Like for example, we have a lot of medical
generally,
management, a lot of treatment.
yeah,
Surgery we will not mention.
no, no, generally,
How will you
And
how will you describe this WPW to a
yeah,
layman?
this is the outline of this scenario. Usually, role player put this all this question one by one. How? So what next? What will do? Is there any cure or
no, he is
lifetime?
asking how will you
No, no.
explain
How to
WPW?
WP syndrome is having a. You will explain first of all that normally the heart
You-
contracts. Heart function is monitored by an electrical signal. Okay,
Yeah,
in a
that you have to
control way.
explain like extra pathway. You have to draw this thing,
Then
abnormal
then
reason.
now you have to tell there is an extra pathway which bypass this pathway. Okay, in a loop
Usually, which
system.
I
Yeah,
was writing from this NHS, they said is a relatively common heart condition that
yeah,
causes the
common.
heart to beat abnormally fast for periods of time
Yes,
due
I also
to electrical connection of the
yeah,
heart and extra electrical connection of the
extra.
in the heart. Yes,
Yeah,
and baby is born with this condition.
condition may not present
Yes,
with a
so
symptom.
may not develop until later in life. Symptoms may
And
not
later,
develop.
yes,
Yeah.
and sometimes it can present any you can diagnose accidentally
Mm.
when you're doing
Yes.
ECG. It's
Mm.
written in the NHS. So I
Yeah.
read this scenario was just to I was I, anyway. This is the any okay.
Okay, no problem, sir.
Okay.
So here about ablation, I have some. I'm not agree about the ablation. Shall we tell the parents or not? And we have to tell as well the last resort. So, as a last resort, we should tell the mother that we have a good treatment of medical this medicines. But if it's not responding, sometimes we will go for the other procedures like heart surgery, like ablation, and we explain the ablation. But it is we should hope for good, and it is very rarely that we go for this kind of procedure.
It depends upon the patient presentation. If frequently coming,
Yeah,
okay,
it's frequently,
then
definitely.
then we will eventually go for the ablation. It is not surgery.
Yeah,
They will
we
go
have to
through
explain the
something.
procedure actually.
Yeah, that is through some catheter or something like that they are doing, I believe, and it's not of any something like big surgery, some minor procedure like that.
Okay. Anyone else has the comment about this WPW? Anyone wants to add something? If not, we will go for the next scenario. The next
Actually,
scenario is
this one we can say for ablation, this is just a disconnection of this electrical pathway.
Yeah,
we will disconnect by some wires, right?
Yeah.
Okay. So the next scenario, the candidate is Dr. Rohel, and the role player is Dr. Heren. So this is the next scenario. So may I start again? Dr. Heren, what is the time in your meeting? Because I already disconnected and started again. So my time is restarting.
Time I cannot see from here because recording is
Anyone
going
can see the time?
on.
So it's better we will reconnect
Okay,
again,
fine,
right?
fine.